So Montefiore has 11 hospitals in the healthcare system, and these are located in the Bronx, Westchester, and the Hudson Valley. So the Bronx really is a special place in that we serve the most vulnerable patients in the country. About 80% of our patients are on Medicaid or Medicare.
There was a lot of discoordination with specifically thyroid cancer therapy patients. At the time, that was the only nuclear medicine therapy that we were actively doing, and patients would come in and be unprepared for their therapy. We'd have the therapy ready for them, but the patient wasn't ready. The patient's families weren't ready, or they were ready and we didn't have the dose. There's a lot of discoordination.
The principal innovation of the nuclear medicine clinic was to provide robust dialogue between patients and physicians, and time and space to allow for that to happen on their own terms. And that really allows patients to become advocates in their own care, armed with the knowledge of their disease process and a clear understanding of their treatment plan. Also at the very basic level, knowing who the nuclear medicine physician is and what their role is.
I started seeing the patients beforehand and really outlining for them exactly what would happen and when. I see the patient for consult and I discuss the intricacies of the care pathway that was discussed at Tumor Board. This gives us the opportunity for a give and take so the patient can actually have input as to what their therapy plan looks like.
Tailoring therapy to an individual patient is critically important. So when Dr. Moadel sees a patient, she makes considerations about whether or not the patient is likely to tolerate radium-223. Considerations include their age, other medical problems, and the current stage of their cancer.
The important part of the consultation for me was really understanding what the treatment pathway was going to be, how they were going to approach the treatment, what the outcomes were, and what I was going to have to do to manage myself in going through this treatment.
A typical consultation with a patient takes about an hour. First, I review the patient's medical history and medications extensively. Then I review these with the patient to make sure that they're correct and the patient provides me with any additional information.
The thing that was impressive about what happened here at Montefiore was that the physician team really kept very close track of what was going to happen and when.
The therapeutic process can often take weeks to months. So during that time, I see patients again and again, and I check in with them to make sure that they are doing well with the therapeutic plan.
We found the therapy plan sheets to be very useful for not only the patients but for the staff. It was an organized way where not only can the patients look at the directions, they have it written in front of them. It also keeps the staff in order as well. They will know if there's anything missing, any blood work that still needs to be done, are there any other insurance issues that are involved that need to be taken care of. This is all included on this sheet.
This is only one of the many phases of a person's treatment, and how it integrates into the whole treatment process is very important, and you learn that during the consultation service.